We know that we haven't infected enough of the population with this virus.
Hi, people. Yeah, I know. It's 3:22 a.m. here. Sadly, I get to read shit and then, yeah, I don't go to bed. I sit up doing videos. Look at the glum face that he's making here, trying to make himself look so fucking sad. But let's continue, shall we? Scott Morrison has offered a qualified apology for failures in managing the risk of COVID-19 in aged care, saying he is deeply sorry about the times when the response may have fallen short. Is that like saying that the aged care, the deaths, that's collateral damage? Because it ain't going to bring any of them back. It ain't going to bring any of them back. Is that what he's trying to say? His government faces mounting pressure over aged care outbreaks. The Prime Minister went on the defensive, saying he and everyone involved in the frontline response were working their hardest to ensure that Australians are not let down during this period. Is he talking about like a similar situation when half of Australia was on fire and he took a vacay in Hawaii? Is that how sorry he is? That he went off to tan while half of Australia was burning? Is that the same kind of sorry? Speaking on a day when the total number of deaths in residential aged care in Australia passed 200, that's 200 murders. That's 200 murders for what they're doing to the people, for what they're doing to aged care people, for disabled people. 200. That's murder. That's murder for everything that is going on that is not collateral damage. It's not a shortfall, okay? It's murder. Morrison said there were no absolute guarantees in a global pandemic, which there isn't, because we all know that the suicide rate now after the lockdowns has bypassed the numbers of this so-called pandemic. But anyway, and that the country as a whole was moving heaven and earth to deal with those unprecedented circumstances. You're moving heaven and earth? Are you fucking serious? Are you serious? Really? You're moving heaven and earth? What is going on in Victoria? Every time I see Daniel Andrews saying something, he's never got a mask on. Obviously, this COVID pandemic knows who it's targeting and who it's not targeting. Every time I see Morrison, he doesn't have no mask on, But anyway, let's move on, shall we? When asked whether he was conceding that the pandemic had gotten the better of the Commonwealth's response in aged care facilities and whether the affected families were owed an apology, Morrison answered in broader terms, on the days that the system falls short, on the days that expectations are not met, I'm deeply sorry about that. Of course I am, and I know that everyone who is involved in the process who is trying to meet these expectations is equally sorry. Morrison said he was offering the Australian people look at this, simple honesty. Honesty. Where the fuck has the government been up until now as far as the elderly, as far as the disabled, as far as aged care homes, disability group homes? When family members try to put in a complaint that something's not right, they don't get listened to. They get palmed off to another phone number, to another phone number, to another phone number. Where was the government then? Where was the government then? This is the same guy, okay? This is the same guy here trying to put on a sad face. Only thing he's missing is a dummy. Trying to put on a sad face. This is the same one that fucked off to Hawaii to get a tan while half of Australia was on fire. But now he wants everybody to think that he's deeply sorry. And we fall short. There are days where we fall short. Let's go on to something else. Let's see how short things actually have fallen all over the place with what's going on. Ants crawling from wounds, horrifying scenes at coronavirus hit aged care home in Melbourne. Horrific footage of a 95-year-old woman left in languish in a Melbourne aged care facility struck by COVID-19 shows ants crawling from a wound on her leg and the bandages around it crusted with blood. The footage and photos described by the federal aged care minister is heartbreaking. Sure, you're all fucking heartbroken. Now you're all heartbroken because somebody's taken pictures and put them out. Where the fuck were you before? Were taken inside Kalina Care, a private residential home in Melbourne's northwest on Tuesday, some 2 weeks after the virus was first identified in one staff member. The woman, known to her family as Milka, died on Friday morning of conditions unrelated to COVID-19. Care staff brought into the home this week have told Guardian Australia that some residents went without food and water for 18 hours. Shit was found on the floor. An ant infestation which had been kept at bay had got out of control in Milka's room. The staff say they were not given adequate facilities to change out of infection-exposed clothing, and basic hygiene was said to have fallen by the wayside, with some residents not cleaned for days. The Guardian has spoken to Milka's family, who say they do not blame the manager's staff. I'd be raining hell down on those fuckers. Why did they not call the family and say, listen, we can't take care of that person. You need to take them home for a while. Could they not have done that? Could they not have done that? Was that too hard to do? But anyway, I feel sorry for Milka because obviously her family didn't give a fuck enough. See, don't blame the managers and staff. Don't blame them. But once the home's health and aged care workers began getting sick and exposed to COVID-19 and were stood down on furloughed, there was no one to fill the gap despite repeated requests from the management to the state and federal governments for help. The whole point of asking for help from federal and state authorities was to avoid disaster like the ones we had seen elsewhere. But when we first asked for help in July, we were not considered bad enough. Then, when our first few residents tested positive, they didn't have severe symptoms yet. So when we asked for them to be taken to the hospital, the response was again, no, it's not bad enough. There's more bits down here that I'm going to find. There's a whole pile to read, but I'm just going to find the most important bits. This bit here, this is the Sun talking apparently. I made an angry call to Kalina asking why they didn't brief the hospital properly, but then I found out it was the hospital that decided that they would treat every person from any nursing home as COVID positive, irrespective of the results, because they didn't trust the tests from aged care, which in a way is sheer arrogance. So Mum was being treated as though a COVID-19 patient, even though she didn't have it. In the end, it didn't matter much because she passed away less than 24 hours later. Hospitals usually separate aged care residents into separate wards, one for patients with suspected COVID-19 but who had not yet received test results, the other for patients who had tested positive. This was not made clear to Rudy. The nurse who spoke to The Guardian said family members of residents were often left confused as to what was happening with their relatives, and poor handover information meant there was little to tell them. The nurse received a call from two people wanting information about their family members after they had been told by another staff member their loved one had acquired COVID-19. But according to the notes I had, they did not have COVID, the nurse said, yet they were in a COVID ward. If they didn't have COVID, they should have been in different space entirely. If they did have COVID, I didn't have any information about it. There's a whole pile here to read, people. A whole pile. Let me find something else. This is one big clusterfuck. And this one's a doozy. Australian experts warn against the use of sedatives to contain COVID spread in aged care. Researchers fear drugs like Valium will be used to confine aged care residents to their rooms in understaffed facilities with coronavirus outbreaks. I understand why some people pick up weapons and go out on a shooting spree. The aged care regulator is investigating a Melbourne aged care home following reports it used sedatives to manage the behaviour of some residents who had tested positive for COVID-19. The Federal Aged Care Minister Richard Colbeck said the Aged Care Quality and Safety Commission was investigating the situation at Glenlyn Care Home in Glenroy. The newspaper alleged some residents considered to be wanderers had been given sedatives to ensure they remained in their room and did not spread the virus after an attempt to have positive residents moved to hospital was rebuffed. But hey, the fact that Andrews and Morrison have people in lockdown, that have people, basically they've murdered people through all of this. This is murder. This is murder. This is medical restraint. Didn't they have a royal commission not so long ago about medically restraining people? Or is that was just something to put out there, to cover all the other bullshit that goes on? The newspaper alleged some residents read that the Morrison government has been working to improve the safe use of medicines and reduce the inappropriate use of chemical restraint in residential aged care, but notes that the situation of Glenlyn involves residents with very complex medical and care needs at a very difficult time, meaning that it's okay to do that? Is that what he's saying? Is that what he's saying? That it's okay?
We know that we haven't infected enough of the population with this virus.
The use of sedatives to manage the behaviour of aged care residents with dementia or cognitive issues was apparently tightened last year after the Royal Commission into Aged Care heard that homes were turning residents into zombies with a heavy reliance on chemical restraint and psychiatric drugs. You know the story on my bro and what the last place did to him by putting him on Oxycontins and Oxycodines that he did not need, screaming that he needed medication for dementia, which my bro doesn't have. So I'm one of those witnesses to say that this goes on, people. This goes on. Aged care experts warned in March that the use of sedatives could increase in homes following a COVID-19 outbreak because of understaffing and the need to confine people to their rooms to prevent the virus from spreading. Stay seated, people. Old age waits for you too. Professor Joseph Ibrahim, the head of the Health Law and Aging Research Unit at Monash University, said that predictions appeared to have come true in some homes, while other homes have reduced their use of sedatives because being closed to visitors had stabilised the routines of people with dementia. But he said that despite aged care homes being required to report on the use of sedatives and psychiatric drugs, there is no publicly available data publicly available data showing how, and indeed if, their use has changed in facilities that have experienced a COVID-19 outbreak. Ibrahim said it's not clear whether drugs prescribed by doctors at state hospitals, which had been brought in by the Victorian government to oversee and supplement the aged care workforce, would also be reported to the Aged Care Quality and Safety Commission. The Australian reported some aged care facilities were using sedatives to prevent residents who had tested positive to COVID-19 from wandering because state hospitals had turned down their request to transfer all positive residents to the hospital. Ibrahim, who was also quoted in that report, said the use of sedatives was concerning. Concerning, people, is an understatement, okay? What, somebody is non-compliant, so what do? You throw them on Valium to turn them into a fucking zombie? Is this what the government is doing now? Is this why the government is taking over these homes, these already neglected homes, so that what? They can give them more of these drugs to turn them into zombies? If it's acceptable to sedate someone so they are not a risk to others, how do you reconcile that with the fact that it's okay to keep residents in a home when they have tested positive to the virus and may also pose a risk, he said. Oh, listen, just throw them on some fucking meds, mate. Throw them on some fucking meds. You know, shit. Ibrahim said Valium and other benzodiazepines reduce a person's respiratory rate, which could impact on the already suppressed breathing of a person who is battling COVID-19. They may make the sick worse, he said. The Royal Melbourne Hospital, which manages in-reach services at a number of aged care homes, said residents who tested positive to COVID-19 are cared for in their home and transferred to hospital if their condition deteriorates. In some cases where residents are prone to agitation and delirium, medications can be used to ensure the safety of themselves and other residents and staff. Really? So who determines that? Who determines that? What if an elderly person complains, saying they don't want to stay in their room, because somebody screamed COVID? What do? What, you knock them out? You turn them into a zombie? And then you forget about them? You fuck off home and you forget about them? Is that what they do? I can tell you now, that's what they do. Go visit some of these places sometimes. Just go in there and say you're a volunteer and you just want to read the Bible or something to these people and see how many of them are actually all there, meaning as in alert. Okay? You'll see they're all zonked down on fucking medication. You can tell by the eyes, you can tell by the way that they respond. My first thing is to look at the eyes. The eyes are a dead giveaway if they're over-medicated. But anyway. Marianne Curry, the Clinical Services Director of Bupa Aged Care, said that Swiftly transferring COVID-positive residents to hospital was critical to controlling an outbreak. Well, really, why is it that we just went through another aged care home and they were calling the hospital and the hospital said they're not sick enough? They're not sick enough. Who determines when somebody is sick enough? If somebody's sick, you take them to the hospital. You take them to the hospital. I mean, the arguments, listen to the arguments. Ibrahim said an argument repeated a number of times by the Victorian Premier Daniel Andrews that people with dementia could be upset by being moved from their home in aged care to the unfamiliar environment of a hospital did not apply to aged care homes whose routine were already radically changed due to the COVID-19 outbreak. So rather than move them to a hospital, just fucking sedate them. Just fucking sedate them. Don't move them, just sedate them. Leave them all there in the same place so that they can all get sick together from whatever and just sedate them. Don't think that this doesn't go on, people. I'm a witness to this. I'm a witness to this kind of medical restraint. That's why I ended up going to court. I was taken to court because I was battling to try and keep my bro from being medically restrained. Did anybody listen to me? No. 16 of the 21 people with COVID-19 who died in Victoria overnight were connected to the aged care system. A story came out not so long ago that somebody in their 20s had died from COVID, but they didn't say, basically, as to did that person have any previous illnesses. It doesn't mean that you have to be aged or elderly to have any kind of respiratory problem. You can have a respiratory problem if you're a child. If you've got asthma, if you suffer from bronchitis attacks, this, that, and the other, your respiratory system is already compromised. But look at that. Australian experts warn against the use of sedatives to contain COVID spread in aged care. I have not much else to say, people. Experts say sedatives that reduce a person's respiratory rate can make a patient who is already battling COVID-19 or a flu much sicker. But yeah, let's lock them all in. Hey, Andrew, let's lock them all in. Mr. Daniel Andrews and Mr. Morrison, let's lock them all in. If this isn't gross negligence, if this isn't a huge lack of duty of care on the government, and this doesn't happen just in private homes, okay? This does not happen just in private aged care. This happens in government aged care as well, okay? In government aged care, even the ones that are sponsored by the government. My bro was in a government facility when he had his feet burnt, his hand burnt. This happens everywhere, people. The neglect, the constant neglect. Does this surprise me at all? Does this surprise me at all? Absolutely not. Researchers fear drugs like Valium will be used to confine aged care residents to their rooms in understaffed facilities with coronavirus outbreak. But hey, let's not do anything, shall we? Let's just put a mask on, continue social distancing, don't leave your home, go shopping only once a week because everything's just fucking peachy. And oh, by the way, government officials like Morrison, Dan Andrews, they're really sorry they killed your family off. They're really sorry that they're going to kill your family off. They're really apologetic that a family member might have committed suicide because of the lockdowns. They're really sorry. You know, they're really sorry.
We know that we haven't infected enough of the population with this virus.